कम रखना, इसके पास है ना तो कभी फोड़ ना करें, मतलब कुछ लूज स्टोक ना करें, बच जाता है।
बता दूंगा, मंदिर वाली बेंच खाली करवा दूंगा ना, इसके आगे कोई बैठेगा नहीं।
जो बैठना होगा ना वो बस बातचीत नहीं करेगा। तो हमारी आवाज़
ठीक है, बस आप लिंक शेयर कर देना।
हेलो,
నమ్మర్ కాదు కదా మట్టిందా
तो अब हम लोग 4 हो गए। वैसे तो ये है कि आप 4 में 40 हो जाता है तो भी ये देगा नहीं, और इसको पता है कि तेरे देने ना देने कुछ होने वाला नहीं है, लेकिन फिर भी आदमी बस।
गुड मॉर्निंग एवरीवन। आई रिक्वेस्ट एवरीवन टू बी सेटल डाउन। A very good morning to all the distinguished dignitaries, respected faculty members, and dear participants. We warmly welcome you to day 2 of this enlightening conference. After an insightful and inspiring first day, we begin today with renewed enthusiasm, curiosity, and commitment to a deeper learning. This session is dedicated to the visionary leadership of Nagar HR, a pioneer in integrative healthcare who has seamlessly bridged the wisdom of traditional system with modern scientific approach to wellness and rehabilitation. His remarkable contributions continue to inspire us in promoting holistic health, enhancing quality of life, and advancing integrative care through the harmonious blend of yoga, science, and compassion. With this inspiring thought, we officially begin the day 2 session celebrating the convergence of tradition and science. Now we begin our technical session. Um, For this, our speaker for today is Dr. Darwin, who is joining us virtually. Dr. Darwin is a registered physiotherapist with a strong academic and clinical background. He completed his bachelor degree in physiotherapy from MGR Medical University, India, and later pursued his Master of Science in Physiotherapy from Cardiff University, UK, with a specialization in neurorehabilitation. He is currently practicing in Canada, where he worked as a full-time physiotherapist in community health in Red Deer, Alberta, and also served part-time at Strike Physiotherapy. Over the years, he has gained extensive experience in managing patients with orthopediatric, neurological, neuropediatric, post-surgical, and sport-related conditions across diverse healthcare settings, including acute care, long-term care, and outpatient service. Dr. Darwin has further enhanced his clinical experience through certification in vestibular rehabilitation, confusion management, TMJ dysfunction, and biomedical dry needling. His approach combines advanced manual therapy, exercise therapy, and patient education, focusing on both recovery and long-term self-management. We are delighted to have such a dedicated and skilled professional with us today. On behalf of organizing committee, I extend a warm welcome to you, Dr. Darwin. Thank you for joining us virtually. We look forward to your insightful session. So please connect the session.
The last 15 years, but currently I'm working at Red Deer with Alberta Health in Canada. So I'd like to really thank you for the organizers for having me. I would like to give a special thanks to Dr. Well, and also Dr. Pradesh for this wonderful opportunity to present at this conference. Today we're going to see is about depression. So what is the key signs for depression? It's loss of motivation, persistent sadness, sleep deprivation, and fatigue. According to WHO, it says 56 million Indians live with depression, but we have less than one psychiatrist per 1 lakh people. So the math doesn't work here. So the treatment gap is almost over 70%. So who fills it? In reality, it's often us, the physiotherapist, the family doctors, and also the family. We all actually work together to support these clients. So the question is not, should we be involved? We already are. The question is, are we accurate? So why physiotherapists? There are 4 reasons physios are uniquely placed. So the first thing is actually access. There are over 1 lakh registered physios in India versus about 9,000 psychiatrists. We are in every district, every town hospital, every private clinic. Secondly, depression presence. 80% of depressed patients, one thing, like how I talked about fatigue, sleep issues, back pain, and headache. Does that sound familiar? Okay. So the third thing is stigma. In India, saying I am seeing a psychiatrist still means he or she is a crazy person for many families. But I'm doing physio for weakness. If they say that, that's kind of accepted. We are a non-stigmatized entry point. And four, the evidence. So in the 2024 Cochrane review, the highest level of evidence says exercise has a moderate to large effect on depression. like antidepressants or cognitive behavioral therapy for mild to moderate cases. So we have the access, we see the symptoms, we have less stigma, and we have the tool. So today we're going to talk about the learning objectives. What we will be covering is, I will explain in very plain language how exercise changes the depressed brain in two pathways. I'm not going to give a detailed neuroscience lecture here, for sure. Secondly, we are going to learn how to screen depression under 2 minutes using a free tool called PHQ9, which I earlier showed in my PowerPoint that is patient help questionnaire. Thirdly, exactly what we have to prescribe for the depression clients. So we're going to talk about the dose, type, and progression to practice in an Indian clinic with no equipment. And finally, the most important part is when not to treat and how to refer safely. So this presentation is not about making you all a psychologist. This is about making you all a better physiotherapist for the patients you already have. So in this slide, we're going to talk about what is the stigma and according to the Indian perspective. In our clinics, patients don't say that I'm depressed. They always say that I have some weakness, I'm not getting any sleep, don't feel like doing anything. These are some of the common information we get it from our clients. So this is also called self-translation, and it's the norm, not the exception here. Because they see what will people say. But here's the advantage. India is always linked with mind and body. We have heard it from our grandmothers. So yoga, pranayama, like breathing exercises, walking, these are all already culturally respected in our Indian culture. So we're not importing any foreign concept. We're using an Indian culture's strength. So when I tell a patient walking is a medicine for your mind, it lands differently than you job is to frame movement as medicine using backwards patterns. So let's talk about the science. Depression is physical. So let's look at depression from a physical lens. For example, if you take brain primary function like concentration, low motivation, all these affects your exercise activities. And if you take sleep, a broken sleep means you will recover your own. So it definitely having difficulty to get on the energy level is so low because psychomotor slowly makes things and cognitions. 3 times the hypers of pain, and pain doesn't respond well to activity. If you take activity, the step counts drop, muscle mass drops, and deconditioning happens. So we're already rehabbing depression. We just need to do it on purpose. So let's see, how does movement will help to increase your movement? So there are a couple of pathways. The first pathway is called brain-derived neurotrophic factor. I call this as actually a miracle grow for the brain. For example, you use miracle grow for your plants, indoor and outdoor. But here, the BDNF actually, this acts as actually miracle grow. Because in depression, the hippocampus, your memory and mood center are actually shrinking. So the BDNF is actually acting as a fertilizer to regrow your new neurons and form new connections. We're going to see about the second pathway in the next slide. So the second pathway is actually called the stress system. In depression, the HPA axis is overactive, so the cortisol is always high. So it is like a stress bucket that's always overflowing. Exercise is actually acting like a tap at the bottom of that bucket with regular movement that lowers the resting cortisol and makes the system less reactive to stress. At the same time, exercise increases serotonin and dopamine, the exact same neurotransmitters that SSRIs, that's the selective serotonin reuptake inhibitors, which is an antidepressant targets. So plus you get endorphins, which is a natural painkillers and modulators. So it's not either medicine or exercise. Exercise hits multiple pathways at once. So that's why it works even when people don't believe in it. It's physiology, not psychology. So what does the evidence say? Is this a real evidence or just feel good talk? So in a study conducted by Cochrane in 2024, they did 218 randomized trials which involved over 14,000 people. The conclusion of the study was that exercise has a moderate effect size of 0.62 for reducing depression. To compare, SSRIs are about 0.55, and then the cognitive behavioral therapy was about 0.71. For a mild to moderate depression, there's no statistical difference between exercise and medication. So, and this is not from a Western data. It is actually done in India, which is Immense Bangalore. They did a randomized controlled trial in urban primary health centers with 12 weeks of group walking plus breathing exercises with no gym or no cost. So the result is 50% drop in PhD scores, and the dropout rate was 15% because it was social, it was free, and it was in the community. So the evidence is very clear. The question is for us is implementation. So what's the prescription? We use FIT, like how we use for cardiac rehab. So the frequency is 3 to 5 days per week. The intensity is quite moderate. How do they know? The talk test, you should be able to talk but not sing, or you can also use the rate of perceived exertion, 5 to 6 out of 10. The timing is, I would recommend 30 to 45 minutes total per day. But here's the key. 10-minute bouts count. So 3 10-minute walk are as good as 1 30-minute walk for. So if you see for the type, aerobic is the best study, but resistance training and mind-body yoga also work. The best combination is always aerobics. But I'll tell you, the most important principle is aerobics. That exercise is the one your patient will absolutely do. For a severely depressed patient, the dosage is just put on the shoes and stand outside for 2 minutes. That itself is a big thing. So something is better than nothing. A 10% increase in activity would cut future depression risk by 8%. So let's do the, how we do the assessment. How do we find these patients is by screening. It takes just 60 seconds. The PHQ-2, that is, ask every patient about chronic pain, fatigue, or medically unexplained symptoms. So it has a couple of questions. I have added those 2 questions here. So you have the first question asks, what were the last 2 weeks? Have you felt down, depressed, or hopeless? If they say yes or no, then move on to your second question, which is, have you had a little interest or passion into increase? If they say yes, then to either of these questions, you will proceed to the full patient health questionnaire 9, which is having 9 questions total. And it might take 2 minutes to complete. If you see the scoring system, 5 to 9 is mild, 10 to 14 is moderate, 15 to 19 is moderately severe, and 20 plus is severe. 0 to 4 would be nothing to do. So this is free. You can easily access online this question. So always my line is we ask everyone these questions because body and mind are connected. It helped me to treat you better. So don't make it a big deal, make it a routine. Once we suspect depression, we need some physio baselines as well.
What?
We need to do some very specific assessments with the following areas as well. So I would start from the T. So if 0 is normative and 10 is person, what is their score? So all these information is taken for a baseline finding so that you can compare it with. So the second one I will check is about activity. How many minutes did you walk last week? Or you can, if you're using a smart watch or something, so you can easily check how many steps they encounter.
नहीं.
Finally, function. You can also do a 30-second sit-stand test or a 60-minute walk test. These are sensitive to change. And the fourth one would be the pain. So use a body chart with depression often white. They have a wide pain problems, not just so you can also use it to ask for therapy. And then finally is about sleep. You have to know how many hours they are sleeping, and you can ask the question like, so you can monitor that how hours of sleep. So all these data you are collecting is baseline information. You can retest it in 4 weeks, and you can tell your clients, sir, ma'am, your walk test has improved this many meters, and your sleeping hours is really gone up 2 hours more. So even if they say, I still feel low, but you can show all the findings you can show that data as a language and you can talk to them and then explain them in a little bit detail. So this will help to earn more trust. Always remember, we need to realize what is the red flags and we need to stop. So, as a physio, we are not physics, we need to remember. We are not psychiatrists, we need to remember that. So, we must know our scope of practice. So, remember to immediately refer when client, especially with the PH29, the ninth question is very, very important. For that, it says in the last 2 weeks, have you had thoughts that you would be better off dead or off treating yourself? If the client says that, then immediately you should consider referring to a psychiatrist or a mental health doctor. And also, psychosis is a very, very important one because they say that I hear voices, not sleeping for more than 3 days. And also some other chest pain, weight loss, or any other conditions. Asking these questions sometimes thank you for speaking. But you need some expert help to help your family. Or you can also family member, get a family member to support. Give that assurance that I'm still going to work with you so that they kind of get the picture that you are taking care of their family. So there is that helpline available. I just found this online. It's a 24/7 12-day helpline. This is available in almost 13 languages to provide me. So this is is non-negotiable. So to reach out to this number. Language, building rapport is very important because language is everything about this thing. Building rapport. Stress makes the body weak. You strength to the body and normalize it. Many people with back pain feel low energy. It's common. Never say it's all in your head or pray more. Be strong. That might be the invocation. Instead, say your body and mind are both carrying a heavy load. So let's work on both together. Let's see some of the practical toolkit here. The principles of prescription. What I would just start with is, first in a 30-minute activity, you need to be starting in a lower level, not giving too much information or too many exercises for your clients. If you think you can walk, if the client can walk for 10 minutes, then prescribe only 5 minutes. Starting slow will really help you to build that self-efficacy. Because depression tells them that you will fail, but you have to prove it wrong. Second, it must be pleasurable, so that the client doesn't hate the recommendation whatever you're giving to the client. For example, if the client hates treadmill, gym or treadmill, then just recommend some gardening. So that might really make the treadmill or gym active. Social is always nice to be here. So the group walk is always a great thing for adherence rather than walking. Fourth is anchoring to a routine. So always like you can do your walking or chair, stands, whatever you have planned after your regular morning tea. Rather than, oh, you have to do 3 times a week. So that might not really set in their mind. So I'm thinking 5 is actually very insane. So just have to conserve energy. Good day, maybe the day when you have a really good energy level. Because that will really crash for the summer. Because please note here, we are treating a brain energy problem. To avoid a setback, we need to really work at a very slow dosage so that your client follows it. Now we are going to talk about recommendations for what we give for our clients. Let's start with exercise. So very low resource ideas are already there. So week 1 and 2 goes just go for 5 to 10 minutes walk. Maybe like once or twice a day. Maybe you can walk to Mandir or maybe walk inside a building compound after a tea. Whatever is more comfortable you can work on that. Week 3 and 4 gradually push to 15 to 20 minutes once a day. Maybe walk to the market instead of taking it all out. Then week 5 and 6 maybe 30 minutes 4 to 5 times a day. Join a walking club or maybe a group walk in your home. After 6 weeks, you can also push to 30 to 45 minutes 5 days a week. So the key point here is progression. Is time first, then frequency, then benefits. People also say, oh, what if something happened? Maybe if it rains or maybe some other thing happened in the family. So you always have some leave, there was an obstacle. So if you can't really go for a walk, then okay, I'll just do 5 minutes of stair climb or maybe some squat or maybe some heel raises and standing close to my kitchen. Anything is going. The second component is resistance training. We're not going to do any resistance training at the gym because apart from aerobic exercises, resistance training is very important as well because depression causes the muscle loss, which will also cause more fatigue and it causes more depression. So we have to break that cycle by having some at least 2 times a week. You're not going to send them to a gym or anything because they think that that's too much for them. So very simple programming. Chair stand, so I ask them to do 3 to 5 sit stand, which is not completely perfect. Push-ups, maybe stand in the kitchen or maybe in the bathroom. You can also recommend them to step ups on the lowest stair while holding on the rail, so that they are quite safe. They can sometimes if you have a TheraBand, you can anchor to the door and then you can do some rolling or sometimes calf raises while waiting for the kettle in the kitchen. So there's multiple ways you can creatively, you can think many ideas and then you can recommend to your clients. I also demonstrate a couple of exercises in the clinic and then I give a tutorial handout for them. It is very, very important because as I said earlier, our depression clients always have concentration and memory issues. So usually words, they don't stick it easily with them. So pictures, visually they can see and then they can track things, they can put it on the table or maybe on the fridge. So whenever they cross by, then they get this idea of, okay, I have to do my exercise. So no equipment means no financial barrier. So easily clients can enter to the program and then you can work on it. And the final thing I would be recommending here is mind and body, because it's really a cultural bridge, because what I usually recommend for my clients are either yoga or breathing exercise. In India, yoga gets instant body emotion. People kind of have a brief idea about it. What usually or Ari, which we call it as breath, which is a very, very great exercise to calm down the brain for clients with depression. If you practice 5 minutes daily, it reduces really the anxiety. So I'm going to normally explain how to do this breath here, so you can watch tons of videos out there on YouTube, so they would explain to you step by step. Other thing you can also recommend, there are so many yoga poses, so just you can come up with the very simple ones which suits for your client. So it's not very complicated for them. For example, is like Sui and Namaskar, even 2 rounds, that's completely fine. It can be done and modified in the chair. That's a perfect, aerobic, resistance, and then mindfulness, and breathing technique. Everything actually is a combined way it's going to help with the recovery for our clients. Finally, we need to address the sleep issues too. Some of the yoga poses exercises really helps to some of the sleep issues as well. There are tons of videos on YouTube how to do yoga and there's amazing apps related to meditation, calm app, all those things you can use. So this would help to address the sleep issues. But always remember, our scope is physiotherapy. Unless you are a certified yoga therapist, you can prescribe more yoga. But if not, I would stick with gentle breathing exercises and simple chair yoga stretches would be great for easy. Another thing is actually client can also get involved in a group format because why do you think groups work so well? There are totally three reasons here. First is actually cost because you don't need to really pay for 10 therapists for 10 patients. If you have one therapist, you can easily have 10 patients together and then you can do a group session. And then there's also a stigma in our community that you can easily say that I'm going for my walking group rather than, oh, I'm having depression, so I'm going for treatment. So, yeah, that's going to help with your clients. And then the third thing is social support. You communicate with your other clients in the group, you know what is the pace and how they're doing okay, so not too bad. There are more people in my group who is in the same pace, so they don't feel really like they're bad, they get motivated. Motivational interviewing, because you need to really know about how to meet your clients, but we are not going to really take a big lecture for a depressed patient into about exercise. You must really pull their motivation out by following, which I'm going to share here, which is called in the short form PORS, which is O stands for open question. So you are going to ask, what would be one good thing if you had more energy? So let them say, playing with grandkids. Okay, great. That's a good goal. Then some of the sample home exercise program I usually give to my client is just giving a one-page energy plan. So keeping it very simple to start with, even like 10 minutes after their 10 minutes of walk after their tea timing, or maybe doing 5 primary breaths, or any kind of other breathing exercises should be okay. Evening they can do 10 chair stands, which is a sit-stand exercise from the chair, or watching any TV commercials or news. So those are some of the ideas. If they just do 2 minutes of walk, that's fine. Still, it's actually okay. So the goal is not to push. You need to really, go in a very gradual and slow fashion here. We give permission to do less because in depression, even at 2 minutes is actually good. So 12 minutes per day. Also, having a family buddy will be really helpful. We list a name and number, and then they can always let you know the family members they can connect, because we don't want our clients to be really isolated. So that is very important. And sometimes actually, I will be having this exercise programs so that they can put it in the fridge, or maybe they can do a checklist whether they can do every day or not. So that will give them a visual feedback, and then that will give them a little dopamine hit, and that's more like a behavioral action on paper. I remember now, yes, we recommended all these exercise programs, aerobic exercises, strength training, the mind-body connection, yoga, all great. Now, how people after clients to adhere to this protocol? So there's it's great. So I'm going to run.
Now we begin our lamp lighting ceremony. For that, I would like to call Dr. Ishin Pasha sir to kindly come forward for lamp lighting ceremony, and I would also wish to invite our respected Dean sir, HOD ma'am, Deputy Dean sir, and all chief guests to please come on the stage for lamp lighting ceremony. I am calling two students for prayer reciting ceremony.
ओम पवित्रः पवित्रो वा सर्वावस्थांगतो विवाशपुण्डरीकाक्षं शुभाय्यावन्त्रस्यो पुण्डरीकाक्षप्नादपुण्डरीकाक्षप्नादपुण्डरीकाक्षपुरादो दीपज्योतिः परं ब्रह्म दीपज्योतिः जनार्दनः दीपो हर्तु मे पापं पूजा दीप नमोऽस्तु ते या कुन्देन्दुतुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिर्देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापः शुक्लां ब्रह्मविचारसार परमां माद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीमभयदां जाड्यान्धकारापहाम् हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम् ॐ नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मम् लोके जरारुग्भयमृत्युनाशं धातारमीशं विविधौषधीनां यं व्योमवातामनिवार्य मन्ये पञ्च प्रपञ्चात्मकदेहम् सन्तापसम्पातजराज्वरान्तकं नमामि धन्वन्तरिमादिदेवम् नवीननीलाम्बुदकान्तिकान्तं शान्तं हरेर्द्वादशमाख्यम् पूर्तिं शतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवम् योगेन चित्तस्य पदेन वाचामलं शरीरस्य च वैद्यकेन योगाकरोतं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि रागादिरोगान् सततानुशक्तान् शेषकाय प्रसृतान् शेषान् औत्सुक्यमोहारतिदाञ्जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै यो पूर्ववैद्याय नमोऽस्तु तस्मै यो पूर्ववैद्याय अयमारम्भः शुभाय शुभं भवतु हरिः ओम्
After lighting the ceremonial lamp, we now seek the blessing of Goddess Saraswati, the symbol of wisdom and knowledge. She represents clarity of thought, value that align with today's conference. To invoke her blessing, we will now have a Saraswati Vandana. I would like to call Divyanshi, we from first year students, to please come forward for this invocation. Divanshi, please come. Thank you, Divanshi.
Carrying forward the momentum of session, it is now our pleasure to introduce our next speaker, Ms. Khayali Mondal ma'am. She is an optometry professional and academician currently serving as an assistant professor in the Department of Optometry at IIMT College of Allied Health Sciences. With over 3 years of experience in both clinical practices and teaching, she has developed strong expertise in comprehensive eye care and optometric training. Her areas of specialization include ocular diagnostic, oculoplasty, ocular prosthesis, and low vision rehabilitation. She has completed her Masters of Optometry with an excellent academic record and has undergone specialized fellowship training in oculoplasty, ocular prosthesis, and low vision services. Ms. Khayali ma'am is a published researcher in the Indian Journal of Ophthalmology with her work focusing on thyroid eye disease and its clinical correlations. She is passionate about integrating evidence-based practice with clinical training and is committed to advancing optometric education and patient care. I now request Ms. Khayali ma'am to kindly come forward and begin her presentation.
Good morning. Thank you so much, ma'am, for your generous words. Good morning, very good morning, everyone. I'm very much honored to be here and presenting my topic. Once again, very good morning, everyone. My name is Khayali Mondal. I'm an assistant professor from the Department of Optometry IIMT College of Allied Health Sciences. So today I am going to talk about something very interesting and honestly little mind-blowing. So my topic is the eye as a window to the brain. Early detection of neurodegenerative disorders through optometry. Now, normally, when we think of an eye checkup, we think generally power checkup, maybe specs, maybe dryness, contact lens. But what if I tell you a simple eye exam can help detect diseases of the brain? Yes, conditions like Alzheimer, Parkinson's, sometimes even before major symptoms appear. So today we will explore how optometry is becoming much more than vision care. It is becoming a tool for early neurological detection. Sounds exciting, right? Let's begin. Next slide, please. Let me start with a very simple question. Imagine a patient walks into your clinic. No major complaints, just routine eye checkup. You do your examination, everything seems fine initially. But you notice something subtle, slight retinal thinning. Now here's the twist. The patient might actually be the early stage of a neurodegenerative disorder without even knowing it. Scary, right? Powerful? Also yes. This is exactly where optometry today is evolving. We are not just correcting vision, we are detecting hidden systemic and neurological conditions. And that makes our role much more important than we often realize. So, slide please. Why we call eye is equals to window to the brain? To understand this concept, we need to understand one basic thing. The eye is not just an isolated organ, it is actually an extension of the brain. During embryological development, the retina originates from neural tissues, same as the brain. And any changes happening in the brain can reflect in the eye. And here's the most fascinating part. The retina is only place in the body where we can directly observe neural tissue and blood vessels non-invasively. Yes, right. Non-invasively. No surgery, no invasive procedure. So in simple words, when we examine the eye, we are directly examining the brain. This is why it is called window to the brain. Please, next slide. Now let's talk about neurodegenerative disorder. Talking about silent progression, you can see in the slides common examples including Alzheimer, Parkinson, and multiple sclerosis. Now the important thing is to understand these diseases don't appear suddenly. They develop slowly, silently, sometimes over years, even though we realize. By the time major symptoms appear, significant damage may have already occurred. And that is the biggest challenge in neurology, late diagnosis. But if we could detect them earlier through the eye, that's where optometry comes in. Slide please. Having said that, if we notice signs during a routine eye examination, we might actually help fighting the disease in a better way. So these neurological diseases often show early signs in the eye. For example, Alzheimer's disease, we often see thinning of the retinal layers. In Parkinson's, patient may show reduced contrast sensitivity, and within abnormal eye movements. And in case of multiple sclerosis, neuritis is a common sign. Moving on to next slide. So, this is our diagnostic tools. Thankfully, we have advanced tools to help us. Some of the most important ones are OCT, which is optical coherence tomography. That gives us a detailed cross-sectional images of retinal layers. Visual field testing, which basically helps us detect functional loss and gives a detailed field of view. Fundus photography, again, it helps us in documentation and monitoring changes in the fundus. These tools are completely non-invasive, quick, highly informative, and most importantly, they help us detect microscopic changes that are not visible clinically. So, technology is making optometry more powerful than ever. Moving on to next slide. So, here are the ocular signature of brain disease. As you can see in the columns, in case of Alzheimer disease, you can see there is a RNFL thinning and retinal amyloid deposit with clinically reduced contrast sensitivity and also visual memory loss. Again, in case of Parkinson's, we can see retinal dopamine loss. You can check this with blood retinal barrier testing, and also impaired color vision is seen with clinical testing. And in case of multiple sclerosis, we can see nystagmus, involuntary eye movement, and also painful eye movement. Moving on to next slide. Let's look at a very simple case. So, you can see a 62-year male presenting in a clinic saying that he doesn't have any major complaint. He just only visit for a stronger reading glasses because he is getting aged. But during the examination, vision was 20/20, which is 6/6 normal vision according to our standard vision guideline. But when we check thoroughly, we see an RNFL retinal nerve fiber layer thinning in the OCT exam, right? Now you refer this patient to a neurologist. What happens next? Further evolution reveals it is an early stage of Alzheimer's disease. What if the patient was not examined carefully? So this disease would have gone undetected for years. So this is the impact we can create as an optometrist, as a front-line eye care practitioner. So, as I always say, prevention is always better than the cure, right? Talking about frontline defenders, moving on to next slide, please. So let's talk about the frontline defenders, which are for the eye care practitioner combined with a neurological department, optometrist, ophthalmologist, and of course a neurology department. This triad can help detect the disease very early and may minimize the condition with early prevention. Next slide. Moving forward, the next future scopes. So the future of optometry is extremely exciting. As we are moving forward, there is AI tools which help retinal analysis, moving on predictive diagnostics, and integration with neurology and general medicine. In the future, there might be a chance an eye can predict disease even before the symptoms appear. So, next slide please. Talking about the keynotes, so let me end this with some thoughts. So next time you examine an eye, don't just look for refractive error. Look deeper. You might find some neurodegenerative condition if you check thoroughly. Right? Next slide, please. Here are some references. So these references help me understood this topic very thoroughly. And before finishing, I would like to say the eye is not just a window to the world, but it is truly a window to the brain. And I would be very happy if you have any questions regarding this topic. Thank you. I'll end this topic right now. Any questions? Yes, ma'am, we have. There are hospitals in which I am not very much aware because I'm not a local person, but I know, might be my colleagues know the names of the hospital, but this is a very common diagnostic tool. So in retina department having OCT, they have OCT.
They are working on this combination neurological detection OCT because if it is available commonly.
Ma'am, actually, earlier I used to work on these things, but right now I'm an academic student, so I'm not very much into touch with these tools. Thank you so much. Thank you. Any more questions? Thank you so much. Have a good day. Thank you for having me.
Thank you, ma'am, for your insightful and engaging presentation. It's truly enriching. I'll now request Chairperson, Dean Sir, Milind Sir, to kindly present the memento to our esteemed speaker, Dr. Khyali ma'am, as a token of appreciation. Dean Sir, please come.
Thank you, ma'am. Thank you, sir. Now it is my privilege to introduce Dr. Prabhas Nath Tripathi, an accomplished researcher in the field of medicine chemistry. Dr. Tripathi earned his MS in medicinal chemistry from the National Institute of Pharmaceutical Education and Research, Kolkata, one of India's premier institutions for pharmaceutical sciences. He has made significant contributions to drug discovery and design, particularly in areas such as enzyme inhibition and molecular docking, with a strong publication record and impactful research outcomes. Currently, he is associated with the Indian Institute of Technology, BHU, where he continues to advance research in medical chemistry and related interdisciplinary. His work reflects a commitment to scientific excellence and innovation, contributing to the development of novel therapeutic strategies. It is my great pleasure to introduce Dr. Prabhas Tripathi, who is joining us virtually today.
Respected chairperson, distinguished guests, faculties, fellow researchers, undergraduate and postgraduate students. It is a pleasure to present my work at this international conference focusing on multidisciplinary approaches to neurodegenerative disorder. My name is Prabhas Tripathi, and I am currently working as a postdoctoral fellow at the University of Arkansas for Medical Sciences, UMS, Little Rock. So, my research primarily focused on neurodegenerative disease, specifically Alzheimer's disease, and I'm medicinal chemist, so I did a lot of synthesis and then I did in vitro, in vivo on mice and rats to evaluate the potential activity of our synthesized compounds. So today I will be presenting on the topic pharmacotherapeutic and Ayurvedic approaches for the treatment of Alzheimer's disease. So everyone knows Alzheimer's disease is one of the most challenging neurological disorders of our time, not only because of its complex pathophysiological and but also due to the limited effectiveness of current treatment. If we will study in graduation and post-graduation, we will know that only 4 and 5 drugs are available for the treatment of the disease. So existing drug that already I discussed, that only provide the symptomatic relief, but they don't significantly change the disease progression, means not completely eradicate the disease. So in this presentation, we will discuss the current understanding of the Alzheimer's disease and limitations of existing pharmacotherapy and potential role of Ayurvedic and complementary approaches. So the key idea of this work is to explore how integrating modern pharmacology with traditional medicinal system that can provide a more holistic and effective strategy for managing the Alzheimer's disease. With significant and insights into multi-target integrative therapeutic approach for the AD. So let's begin with the brief introduction to Alzheimer's disease. So Alzheimer's disease is commonly known as AD in short form, but this is a progressive neurodegenerative and neurocognitive disorder, and that is specifically and mainly characterized by loss of memory, cognitive decline, and impairment of daily functioning. So that kind of ability and behavior also you can observe that. So these are the special features, special character we can say that this is symptoms associated with this kind of disease. So it is the most common leading disease worldwide. So this is accounting for the major dementia cases. So the disease, was first described by Alois Alzheimer in 1901. What he observed the unusual symptoms in patients, including severe memory loss and behavioral changes. So upon post-mortem examination, he identified the brain shrinkage. You will see there is two parts. One, healthy brain size is normal in size, it looks like normal. But in another part, you can see the shrunken brain. That is the symptoms of, that is the identification of the Alzheimer's disease. So brain shrinkage, and parallelly he saw the abnormal protein deposition, which later hallmark of the disease. So Alois Alzheimer, he identified the shrinkage of the brain while autopsy. Okay, so this, and in another diagram you can see that is the picture of the brain, shrinkage part of the brain, it associated with the Alzheimer. And these are the feature and symptoms that doctor and physician recognize. On the basis of that, they can say that the person is suffering from Alzheimer's disease. So cognition, which include process like attention, memory, perception and decision making and judgment, is essential for the normal human functioning. So in Alzheimer's disease, cognitive ability gradually decline, so that leading to the loss of independence in daily life. So it is important to note that cognitive impairment can also occur due to the aging, toxins and injury. That is another way we can say post-traumatic injury. But Alzheimer's disease is progressive and irreversible, making it particularly serious. So progressive and reversible means not slowly deteriorate, and deteriorate means it cannot be regenerate. So that's why this disease is called as irreversible and slowly progressive. Slowly nerve will get damaged. So it cannot be reversed. So that's why it's this disease is irreversible. So here only we can observe this thing. So in the next slide, we will discuss the global burden of the Alzheimer's disease. So this slide highlights why Alzheimer's disease is considered one of the most important public health challenges of 21st century. So Alzheimer's disease is not only neurological disorder, but also a rapidly growing global epidemic. It affecting individuals, families, healthcare, and national economy. Currently, more than 55 million people worldwide are living with dementia, and Alzheimer's disease accounts for nearly 60 to 70% of these cases. So what is the primarily concerning is the rate of increase. A new case of dementia is estimated to occur approximately every 3 seconds globally, reflecting the extremely fast progression of disease burden across the population. If we look The projection, this number is expected to rise dramatically to around the 150 million cases by 250, largely driven by the increase in the life expectancy, aging, population, and improved diagnosis and reporting. From economics perspective, the burden is equally alarming. Why? Because the global cost of the dementia care was around 1.3 trillion, estimated 1.3 trillion US dollar in 2019, and it is projected to increase 3 trillion US dollar by 2030. So these costs include not only medical treatment but also long-term care, caregivers, burden, and productivity loss. So these costs, importantly, the burden is not equally distributed. Low and middle income countries are expected to experience the fastest growth in case due to the limited healthcare infrastructures, lack of early diagnosis, and reduced access to long-term care facilities. If we will talk about the South and East Asia, particularly our countries and China, the number of Alzheimer's disease is expected to rise significantly. India alone is currently estimated 4 million individuals affected, and this number is expected to increase sharply in the coming decades. Now I will discuss one of the most established and clinically relevant mechanisms in Alzheimer's disease, that known as the cholinergic hypothesis. So in our brain system, hippocampus and cortex area and basal forebrain, there is a neurons, and that neuron release the. So moving forward, this slide focuses on the current FDA approved pharmacological treatment available for Alzheimer's disease and their limitations. At present, acetylcholinesterase inhibitors, these drugs like donepezil, rivastigmine, galantamine, and tacrolimus, these 4 drugs are FDA approved drugs. But among these 4 drugs, tacrolimus has been withdrawn from the market because of it has hepatotoxicity. So these all 4 drugs are acetylcholinesterase inhibitor. Another drug that is a memantine, and this memantine NMDA receptor antagonist. So we will discuss this NMDA receptor antagonist, right? This is the NMDA receptor antagonist in the coming slides. So acetylcholinesterase inhibitor work by blocking the acetylcholinesterase enzyme, as I told you in previous slides, which prevent the breakdown of the acetylcholine. As a result, they help to enhance the cholinergic function temporarily, not permanently. On the other hand, memantine act on the glutamatergic system by regulating the NMDA receptor activity. It helps to reduce excessive excitatory signaling and the calcium overload, which link to neuronal damage. Although these drugs provide the only symptomatic relief, when I started this presentation, I informed this thing. It only provides a symptomatic relief, only cure the symptoms, not the disease progression. So that's why this is generally modest and temporary. So they don't stop and reverse the neurodegenerative process. Another important limitation that is the presence of the side effect which can include gastrointestinal disturbance such as nausea, diarrhea, muscle cramps and weakness and dizziness and fatigue. So these adverse effects often reduce patient compliance, especially during long-term treatment. Additionally, earlier drug tackling that withdrawn from the hepatotoxicity that we can call liver damage. So that is the concern of this case. So overall, while current therapy are useful for temporary cognitive improvement, they clearly don't address the progressive nature of the Alzheimer's disease. So here emphasizing the need for safer disease modifying strategy. So now I will discuss another important pathological mechanism involved in the stress. So oxidative stress is another factor that caused by the imbalance between the reactive oxygen and the antioxidant. So basically excessive ROS release causes the oxidative damage in the brain and lead to impaired cognitive function. Okay, so all these are interconnected. Accumulation of amyloid beta also lead to oxidative damage in the brain. So therefore, the development of neurotherapy agent can improve the metabolism of serotonin by making serotonin state damage and provide the antioxidant activity. This the brain decrease the disease progression. This is required. So that is the thing that we are thinking that we can cure this disease. This slide, this section highlights why there is a need for new improve therapeutic strategy in Alzheimer's disease management. So Alzheimer's disease is a renal progression irreversible treatments. But because existing pharmacological therapies mainly provide the temporary symptoms. So in addition, these treatments are associated with several challenges, efficacy, adverse side effects, and poor patient compliance. So before Alzheimer's disease, targeting only single pathway such as cognitive dysfunction is not sufficient to control disease progression effectively. So this has led researchers to explore alternative and complementary therapeutic approaches that can act on multiple disease pathways simultaneously, like traditional medical systems such as Ayurveda and traditional Chinese medicine are gaining and increasing scientific interest. So these systems are based on the holistic treatment philosophy, focusing not only the symptoms but also overall body balance and long-term wellness. So another important advantage is that they primarily use natural products and herbal compounds. So that are associated with why they are often associated with this, because lower toxicity, better tolerability and long-term safety potential. That's why integrating the modern pharmacological approaches with traditional medicine system offer a promising strategy to target multiple pathological mechanisms. We will discuss all the pathological mechanisms in the coming slides and improve the. Here I will discuss the oral pathogenesis of Alzheimer's disease, which is important to understand because Alzheimer's disease is not driven by single mechanism but rather by multiple interconnected pathological pathways. Alzheimer's disease is therefore considered a multifactorial neurodegenerative disorder where several molecular and cellular events contributed simultaneously to disease progression. So, cholinergic hypothesis that is well accepted and classical mechanism for the of a cause of this Alzheimer's disease. Second one is the amyloid beta hypothesis that is caused by the accumulation of amyloid beta. And third one is the tau hypothesis that is the hyperphosphorylation of the tau aggregate into the neurofibril tangles and disrupting the microtubules. And excitotoxic hypothesis that is so there is a one drug available on this for a treatment of for this hypothesis is the NMDA receptor antagonist. And oxidative stress hypothesis that in this hypothesis we will discuss about the role of reactive oxygen species and antioxidant enzyme. And ApoE hypothesis, GSK3 hypothesis, and the last one chronic inflammation hypothesis that is the microglia activation inflammatory neurodegeneration. So cholinergic hypothesis, here you will see choline will go inside this neuron, and here acetylcholine A enzyme react with this choline to form the choline, and this choline and acetylcholine react with the CAT enzyme. The CAT is here is the cholinergic acetyltransferase, and it formed the another hypothesis is that I already told you that this is the amyloid hypothesis. In amyloid hypothesis, which is one of the central and most widely studied mechanisms in Alzheimer's disease. This hypothesis is based on the abnormal metabolism of the membrane protein called APP, means amyloid precursor protein. Under normal conditions, this APP is processed in the non-toxic pathway, and in Alzheimer's disease it undergo aberrant cleavage pathway. So in this altered processing, APP cleaved by specific enzyme leading to formation of amyloid beta. Okay, and these peptides have a strong tendency to aggregate and misfold. Once a formed amyloid beta, this amyloid beta accumulate extracellularly and gradually form the insoluble amyloid plaques. So these plaques considered one of the hallmark pathological feature of Alzheimer's disease. So these amyloid plaques interfere with the normal neuronal. So continuing from the previous slide, this section further explains the downstream effect of amyloid beta accumulation in Alzheimer's disease. Once Alzheimer's disease peptides are produced, begin to aggregate, they gradually form the oligomers and the fibrils, and which eventually deposit as a senile plaque. And this senile plaque causes inflammatory reaction, microglia activity. Now I will discuss the tau protein hypothesis, which explains another pathological hallmark of Alzheimer's disease along with amyloid beta. So what happened? Tau is a microtubule associated protein, and that normally play essential role in maintaining the neuronal structure by stabilizing the microtubule. These microtubules are important for axonal transport, which allow movement of the nutrients and cellular component within the neurons. In Alzheimer's disease, this tau goes abnormal hyperphosphorylation mainly due to the overactivation of the kinase. Okay, these are the main CDK5 and GSK3 beta, all these kinase so that increase the over and hyperphosphorylation of this tau protein in cause this kind of disease. So here next we will discuss the another hypothesis, glutamatergic and excitotoxic hypothesis. So here which this hypothesis explain how and how excessive neuronal stimulation contribute the neurodegeneration in Alzheimer's disease. So, under normal physiological condition, glutamate is the main excitatory neurotransmitter already been known, like gamma is a inhibitory neurotransmitter in our brain system. So, in Alzheimer's disease, this regulation of the glutamate signal and leading to overstimulation of glutamate receptors. So glutamate receptor activated too much, so calcium, so particular NMDA receptor that I already discussed. So another hypothesis, I am connecting all these both hypotheses all together, like oxidative stress and chronic inflammation hypothesis. So now I will discuss two closely interconnected mechanisms in Alzheimer's disease. That is very, very important, oxidative stress and chronic inflammation. These two processes can together significantly accelerate the neurodegeneration. First, oxidative stress refers to the excessive production of the reactive oxygen species and in the brain, and under normal condition if you will see, ROS are balanced by antioxidant system, but in the Alzheimer's disease this balance is disrupted. So excess ROS leads to damage the key cellular component including lipid in the neuronal membrane. So now I will summarize the limitation of currently available FDA approved therapy in this slide, which directly explain why new treatment strategies are urgently needed. As discussed earlier, the main approved drug, acetylcholinesterase inhibitor, donepezil, rivastigmine, and galantamine, along with NMDA receptor antagonist memantine, these drugs work by targeting the symptomatic pathways by increasing the cholinergic transmission and reducing the excitotoxicity. However, the major limitation already I discussed, so that's why we need a complementary alternative therapy to overcome this problem. So in this slide, complementary therapy means integrated management of Alzheimer's disease using alternative and herbal approaches. So now I will discuss complementary integrated therapeutic approaches that are being explored alongside conventional treatment for Alzheimer's disease. These approaches are gaining attention because they focus not only symptom management but also supporting overall brain health and slowing functional decline. So complementary therapy include wide range of non-pharmacological intervention like yoga and physical exercise, meditation, and mindfulness practice, and acupuncture, and cognitive stimulation, and behavioral therapies, nutritional dietary intervention. And these approaches are believed to help by improving brain plasticity, reducing stress, and enhancing overall neurological function. So, what is the continuation from my previous slide? This section further emphasizes the broader landscape of the complementary and integrative approaches in Alzheimer's disease management, how they may contribute to improving patient outcomes when used alongside standard therapy. Complementary therapies are particularly important in Alzheimer's disease because it is a chronic, progressive, and multifactorial disorder where long-term supportive care become important as a pharmacological treatment. One of the key areas being explored in mind-body intervention like yoga, meditations, okay, breathing exercise, mindfulness-based stress reducing technique, and these practices are believed to reduce the stress hormone levels such as cortisol, improve the emotional stability, enhance the cognitive resilience. In several studies, regular practice has associated with improve in the attention, memory retention, overall quality of life in elderly population. Another important category is the dietary nutritional intervention. Their diet play a crucial role in brain health in certain dietary patterns such as Mediterranean diet. Dash diet are associated with lower risk of cognitive decline. So these diet are rich in antioxidant. That's why uh, we are preferring and healthy fats like omega-3 fatty acid, vitamins and polyphenols. These components help in reducing the oxidative stress and inflammation which are central to we discuss specific Ayurvedic medicinal plants that have been traditionally used and are increasingly being studied for their potential role in disease and cognitive disorder. Medicinal plant from core foundation of Ayurvedic neurotherapy, especially under the concept of Madhyarasayana, which focus emphasize on improving memory, intelligence, and brain function. One of the most widely studied plant is the Bacopa monnieri, this commonly known as everyone Brahmi. The Brahmi has the traditional use to enhance the memory, learning ability, and from scientific perspective it has been reported to support the synaptic communication, reduce oxidative stress, and improve neuronal signaling. It also been investigated for its potential role in modulating cholinergic activity, which is a highly relevant in Alzheimer's disease. So another important plant here is a Withenia somnifera, that is also known as a ashwagandha. It has a withanolides. It's so Ayurvedic herbal formulation. So a lot of Ayurvedic herbal formulation are available. Madhya, 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 memory enhancer, adaptogen enhancer, some Madhu, Mandhu, Kapani, Guduchi, Yasti Madhu, Glycyrrhiza glabra. These all are Madhya Rasayana intelligence promoter. That is a one formulation that is available, and these all ingredients are available in this form. So it basically intelligence promoter means बुद्धि बढ़ाने की दवा इसको अपन बोल सकते हैं. So evidence Sanfus we uh, uh, studied in vivo model, so it decreased mRNA expression in M1 receptor, CAT or NGF-TIK receptor in cerebral cortex of the body. So, and they also did the elevated plasmase and Morris Waterman study is to prove the Alzheimer's disease. So a lot of Ayurvedic herbal formulation are available in Saraswata Churna. That is the available many way. Saraswata Rishtha, Manas Mitra Guttika, Abana tablet form, BRS 69 mentate. So polyherbal composition that contain the 26 medicinal plants. So, what is the future plan and conclusion? So, the future of Alzheimer's disease treatment is moving toward the multi-target and integrative therapeutic strategy. Instead of focusing one molecular target, and future drug development should aim to modulate multiple neurotransmitter systems, reduce amyloid and tau pathology, control oxidative stress and the inflammation, and the mitochondrial function, and enhance the survival and synaptic plasticity. So multi-target strategy is essential because Alzheimer's behave as a why it behave as a multi, because the network disorder rather than a single pathway disease. So integration of Ayurveda and modern medicine, one of the key highlight of this work is to potential integration of the traditional medicine systems such as Ayurveda with modern pharmacotherapy. Ayurveda provide, provides a rich source of neuroprotective herbs, polyherbal formulation, and holistic treatment principles. Modern science, on the other hand, provides the molecular understanding of the disease. So Alzheimer's disease continue to represent one of the most challenging. I would like sincerely thanks again organizing committee of this international conference, all respected faculty member and fellow researcher for giving me this opportunity to present my views. Thank you very, very much for your kind attention. I would be happy to take any question. Thank you very much.
Hello, it's a great session. Respected chairperson, distinguished speakers, and dear delegates. Now we move for a fourth speaker of the session. It's my honor to introduce Dr. Pragya Sharma, a dedicated professional in the field of Ayurveda, holding a BAMS and MD in Kaya with over a decade of rich clinical and academic experience. She has made significant contribution to both patient care and medical education. Currently serving as an associate professor and consultant, she has been actively involved in shaping future practitioners while continuing her clinical practice. Her journey reflects a remarkable blend of knowledge, compassion, and leadership. As a founder of Praktan Ayurveda, she has demonstrated a strong commitment to promoting traditional healing system in a modern context. Her experience spans reputed institutions where she has delivered lecture, managed outpatient department, and guided students with dedication and expertise. Beyond her clinical and teaching role, Dr. Sharma has contributed to academic community through publication in international journal and presentation at national seminars, showcasing her commitment to advancing Ayurvedic science on global platform. Today we are truly fortunate to have her among us. Her insight, experience and passion for holistic healthcare will undoubtedly enrich our discussion and inspire all of us. I respectfully invite Dr. Pragya ma'am to kindly come on stage and commence the session.
Good morning everyone. Thank you so much for giving me this opportunity. Myself Dr. Pragya Sharma and I am Associate Professor in Thai Chikitsa Department in IIMT only. So today we are going to discuss about some innovative management of neurodegenerative disorders regarding depression, Alzheimer's and other things. Let's start with the first slide. So we are going to discuss the objectives as understanding disorders and depression, Ayurvedic concepts, and integrative management, innovative therapies. First of all, we are going to discuss about the global burden. So what is global burden? जैसे कि पहला पॉइंट लिखा है इट इज राइजिंग प्रेवलेंस। राइजिंग प्रेवलेंस का क्या मतलब हुआ? इट इज काइंड ऑफ कितने सालों में कितने ज्यादा पेशेंट्स इंक्रीज हुए हैं। So before understanding all these things, I must tell you about Ayurveda first of all. We have three things, three doshas, like Vata, Pitta and Kapha. This is very important to understand before discussing all these things. वात जो है और पित्त और कफ, ये तीनों ही चीजें हमारी बॉडी में अकॉर्डिंग टू एज इंक्रीज करते हैं। लाइक इन चाइल्डहुड हमारी बॉडी में कफ रेज रहता है, इन एडोलेसेंट एज एंड इन अडल्ट एज हमारी बॉडी में पित्त बढ़ा रहता है, एंड आफ्टर कमिंग टू ओल्डर एज हमारी बॉडी में वात बढ़ जाता है। तो वात का बेसिक रोल क्या है? वात का काम होता है टू मेंटेन कोऑर्डिनेशन ऑफ द बॉडी or to maintain the control of the body. If I'm speaking, if I'm moving my hand, it is just because of वात। और जैसे जैसे हमारी एज बढ़ती है, जैसे जैसे हमारा वात बढ़ता है, वैसे वैसे रिलेटेड टू वात जो भी डिजीजेस हैं वो हमारी बॉडी में स्टार्ट हो जाएंगे। एंड जो राइजिंग प्रेवलेंस है वो इसका मतलब यही है कि जैसे जैसे पेशेंट्स ग्रो कर रहे हैं इनटू एज, एजेस के अकॉर्डिंगली पेशेंट्स का वात भी बढ़ता जा रहा है और उनके डिजीजेस भी बढ़ रहे हैं। सिर्फ और सिर्फ एज ही इकलौता इशू नहीं है, इश्यूज ये भी है कि अगर हम रात को टाइमली नहीं सोते हैं, इफ यू हैव एवर नोटिस्ड कि रात को अगर आप देर से सोए हैं एंड अर्ली मॉर्निंग अगर आप जब उठते हैं तो यू फील काइंड ऑफ स्टिफनेस इन योर बॉडी। दैट स्टिफनेस और दैट डलनेस इज जस्ट बिकॉज ऑफ रेज ऑफ वात। नेक्स्ट है हमारा एजिंग पॉपुलेशन। एजिंग पॉपुलेशन का मतलब है मोर लाइफ इज इक्वल्स टू मोर डिसऑर्डर्स। जितनी ज्यादा एज बढ़ रही है उतना ही ज्यादा वात बढ़ रहा है और उतनी ही ज्यादा वात से रिलेटेड डिजीज हमारी बॉडी में हो रही है। एक दो बार वात बढ़ना इट इज नॉट दैट मच डिफिकल्ट, बट कॉन्टिन्यूएशन में अगर सेम चीज होती है तो वो जो बढ़ा हुआ वात है वो हमारी बॉडी में स्टे कर जाता है एंड उसकी वजह से जो डिप्रेशन या जो एंजाइटी रिलेटेड डिसऑर्डर्स हैं वो बनना शुरू हो जाते हैं। नेक्स्ट नेक्स्ट पॉइंट है इसमें हाई इकोनॉमिक बर्डन। हाई इकोनॉमिक बर्डन इज जब पेशेंट कॉन्टिन्यूसली बहुत लंबे समय तक एज अ पेशेंट ही रहता है तो पेशेंट जो है कॉन्टिन्यूसली ट्रीटमेंट ही फॉलो करता है, एंड कॉन्टिन्यूस ट्रीटमेंट इज ऑलवेज कॉस्ट इफेक्टिव। कॉस्ट इफेक्टिव तब रहेगा जब पेशेंट जल्दी ठीक होगा, लेकिन कॉस्ट का बर्डन तब हो जाएगा जब पेशेंट लंबे समय तक दवाइयाँ खाता रहेगा। और वात वाली डिजीजेस जितनी होती हैं वो सभी डिजीजेस लंबे टाइम तक पेशेंट को ट्रीटमेंट लेने पे मजबूर करके रखती हैं, इसीलिए हाई इकोनॉमिक बर्डन भी डे बाय डे रेज हो रहा है। नेक्स्ट वी हैव टू अंडरस्टैंड न्यूरोडीजनरेटिव डिसऑर्डर। इसमें दो पार्ट्स हमने किए हैं, एक रिलेटेड टू मॉडर्न वेस्टर्न डायग्नोसिस एंड सेकेंड वन इज रिलेटेड टू आयुर्वेदा। वेस्टर्न डायग्नोसिस में अगर हम देखें तो वी हैव Alzheimer disease, Parkinson's disease and amyotrophic lateral sclerosis. Alzheimer's disease क्या होता है? Alzheimer's it affects mainly our memory and thinking and also behavior. ठीक? Next आता है हमारा Parkinson's disease. Parkinson's disease में क्या होता है? It causes tremors. Tremors means हमारी बॉडी में जो कंपन होता है that is called tremors. Stiffness and slow movements. Generally Parkinson's के patient हर वक्त उनकी बॉडी में ट्रेमर रहेगा, बहुत स्लो मूवमेंट कर पाते हैं, जस्ट बिकॉज उनका वात दोष जो है वो बैलेंस नहीं होता है। नेक्स्ट आता है हमारा इसमें ALS यानी कि अमायोट्रोपिक लेटरल स्क्लेरोसिस। दिस आल्सो लीड्स टू प्रोग्रेसिव मसल वीकनेस ड्यू टू नर्व डैमेज, और ये नर्व डैमेज का कारण भी हमारा इम्बैलेंस्ड वात दोष ही है। इसको अगर हम आयुर्वेद में समझते हैं देन अगेन आई हैव रिटन ओवर देयर वात व्याधि। वात व्याधि ही हमारा न्यूरोडीजनरेटिव डिसऑर्डर्स का कारण है। नेक्स्ट आता है इसमें मज्जाक्षय। मज्जा इज ऑल्सो अ धातु ऑफ आवर बॉडी। वी हैव टोटल 7 धातु जिसे हम सप्त धातु बोलते हैं। जिसमें एक धातु हमारा मज्जा भी है, और मज्जा का क्षय होने के कारण से हमारी बॉडी में डीजेनरेशन या डिप्लीशन ऑफ नर्व टिश्यूज प्रेजेंट हो जाते हैं। नेक्स्ट स्लाइड। फर्स्ट ऑफ ऑल कमिंग टू डिप्रेशन। डिप्रेशन में अगेन हमने दो डिफरेंट पार्ट्स किए हैं। एक हमारा क्लिनिकल मैनिफेस्टेशन अकॉर्डिंग टू मॉडर्न एंड सेकंड है हमारा आयुर्वेदिक पर्सपेक्टिव। द इमेज यू कैन सी एज अ क्लाउड एंड अ वाटर। इट इज जस्ट टू शो कि एक इमोशनल बर्डन पेशेंट के ऊपर हो जाता है व्हाइल द पेशेंट इज इन डिप्रेशन। इसमें पेशेंट को प्रोफाउंड सैडनेस एंड एंजाइटी रहता है। नींद कभी पेशेंट को आती है कभी नहीं आती है। सो पेशेंट में बी इंसोम्नियक एंड मे बी हाइपरसोम्नियक। इंसोम्नियक का मतलब हुआ पेशेंट को नींद नहीं आना। पेशेंट इतना डिप्रेस रहेगा, कॉन्टिन्यूसली ही और शी मे बी थिंकिंग अबाउट समथिंग एंड उसको नींद नहीं आती है। एंड समटाइम्स पेशेंट में बी हाइपरसोम्नियक। हाइपरसोम्नियक का मतलब है पेशेंट कॉन्टिन्यूसली नींद में रहता है। इसको अगर हम आयुर्वेद से रिलेट करें तो आयुर्वेद में हम इसको मानेंगे एक रज और तम। हमारी बॉडी में तीन तरह की और चीजें हैं जिसको हम सत्व, रज और तम बोलते हैं। ये तीनों चीजें भी बैलेंस्ड होनी चाहिए। अगर सत्व का काम है बॉडी को मेंटेन करना, रज और तम ये दोनों चीजें, रज का काम है हमारी बॉडी की एक्टिविटी, रेस्टलेसनेस, इनको मेंटेन करता है, और तम की वजह से बॉडी में हैवीनेस और डलनेस क्रिएट हो जाती है। और अगर रज और तम दोनों ही बैलेंस्ड नहीं रहते हैं तब हमारा ब्रेन जो है वो इवेंचुअली डिस्टर्ब हो जाता है। इसकी वजह से पेशेंट को न्यूरोडिजेनरेटिव डिसऑर्डर्स प्रेजेंट हो जाते हैं। आयुर्वेद के अकॉर्डिंगली हमें अपने सारे दोष और धातु ये सारी ही चीजें बैलेंस करके ही चलना है। उसके लिए डिफरेंट आचार्यों ने बहुत सारी चीजें बताई हैं, लाइक आपका मेंटेनिंग द लाइफस्टाइल में आपको मॉर्निंग में किस टाइम उठना है, उसके बाद आपकी दिनचर्या कैसी होनी चाहिए, उन सब चीजों के पैटर्न्स हैं। एज आज की डेट में जनरली स्टूडेंट्स नहीं फॉलो करते हैं, इवन बहुत हद तक हम लोग भी फॉलो नहीं कर पाते हैं बिकॉज ऑफ मेनी रीजंस। बट इवेंचुअली आज हमें नहीं फील हो रहा है, लेकिन कुछ सालों के बाद हमें ये सारी प्रॉब्लम्स फेस करनी पड़ेगी। बिकॉज चाहे कितना भी मॉडर्नाइजेशन हो जाए बट ह्यूमन बॉडी विल ऑलवेज बी एज अ ह्यूमन बॉडी। Brain gut axis. What is brain gut axis? Brain is our brain, gut is our intestine, and axis is the balance between the brain and the gut. मॉडर्न साइंस मैकेनिज्म अगर हम देखें तो ब्रेन और जो हमारा गट है इट इज काइंड ऑफ टू वे सिस्टम। टू वे सिस्टम का क्या मतलब हुआ कि अगर हमारा ब्रेन हेल्दी है तो हमारा गट भी हेल्दी होगा। एज इफ अगर आपका मूड अच्छा है तो आपको अच्छी चीजें खाने का मन करता है या आपको भूख लगती है, बट अगर आपका ब्रेन हेल्दी फील नहीं कर रहा है या साउंड फील नहीं कर रहा है तब आपको भूख नहीं लगती है। सेम ऑपोजिट अगर हम देखें, अगर हमारा गट हेल्दी है, डाइजेशन प्रॉपर हो रहा है, तो हम प्रॉपरली सोच पाते हैं, समझ पाते हैं, अपना डेली रूटीन का काम अच्छे से कर पाते हैं। तो ये टू वे सिस्टम होता है। अगर किसी भी तरह का माइक्रोबायोम या इन्फ्लेमेशन हमारी बॉडी में प्रेजेंट है तो हमारे जो सेल्स हैं वो डिस्टर्ब होते हैं और इवेंचुअली हमारा ब्रेन का मैकेनिज्म स्लो डाउन हो जाता है। आयुर्वेद के अकॉर्डिंगली अगर हम लें तो देयर इज वन थिंग, अग्नि। एज फ्यू आयुर्वेदिक स्टूडेंट्स आर आल्सो सिटिंग ओवर देयर, तो आप लोगों को पता ही है देयर इज अग्नि, जिसको हम हमारी बॉडी का इम्पॉर्टेंट फैक्टर मानते हैं, जिसकी वजह से हमारी बॉडी सम अवस्था में रहती है और जिसके बिगड़ने की वजह से हमारी बॉडी में डिस्टर्बेंसेस क्रिएट होते हैं। अग्नि अगर सामान्य अवस्था में होती है तो हमारी बॉडी का डाइजेशन प्रॉपर होता है। डाइजेशन प्रॉपर होगा तो जो भी हमने खाया है दैट विल प्रॉपरली एक्यूमुलेट, एसिमिलेट एंड अब्सॉर्ब इन आवर बॉडी। और अच्छी चीज अगर प्रॉपरली अब्सॉर्ब होगी तो वो हेल्दी सेल्स को ही प्रोड्यूस कराएंगे। बट अगर ये अग्नि, ये हमारी वाइटल डाइजेस्टिव फायर है, ये अगर प्रॉपर नहीं होगी तो डाइजेशन प्रॉपर नहीं हो सकता है, जिसके कारण से एक टर्म है वी यूज इन आयुर्वेदा, इट इज कॉल्ड आम। आम का मतलब होता है टॉक्सिन्स या फ्री रेडिकल्स जो हमारी बॉडी में, एंड जितने ज्यादा हमारी बॉडी में फ्री रेडिकल्स डिपॉजिट होंगे उतना ज्यादा हमारी बॉडी एक तरीके से बीमारियों का घर बन जाता है। सो एज यू कैन सी इन द लास्ट इमेज देयर इज अ गट which is not looking as a healthy gut. जस्ट बिकॉज क्योंकि आम का डिपॉजिशन बहुत ज़्यादा हो गया है, जिसके कारण से अगेन हमारी अग्नि, ये टू वे प्रोसेस होगा। अगर अग्नि की वजह से टॉक्सिन्स बढ़ गए हैं बॉडी में, तो वो टॉक्सिन्स एक्यूमुलेट होके वापस से हमारी अग्नि को ही और कम करना स्टार्ट कर देते हैं, जिसके कारण से ब्रेन फंक्शंस और ज्यादा स्लोअर डाउन हो जाएंगे। पैथोफिजियोलॉजी अगर इसकी हम समझें, अकॉर्डिंग टू मॉडर्न मैकेनिज्म, एक ऑक्सीडेटिव स्ट्रेस होता है बॉडी में, जिसके साथ क्रॉनिक इन्फ्लेमेशन भी बॉडी में बढ़ सकती है। क्रॉनिक इन्फ्लेमेशन बढ़ने का मतलब है किसी भी टाइप की कोई डिस्टर्बेंस अगर हमारा गट फेस कर रहा है। तो as you can see the image in between these two images, there is one brain, then heart and the gut, and surrounding is kind of cells. अगर हमारी बॉडी में कोई भी ऑक्सीडेटिव स्ट्रेस है और इन्फ्लेमेशन है, तो हमारा ब्रेन, हार्ट एंड इंटेस्टाइन्स और ऑर्गन्स विल नॉट वर्क प्रॉपर्ली, जिसके कारण जब ये सारी चीजें प्रॉपर्ली काम नहीं करेगी, तब हमारी बॉडी का एक और फैक्टर है, दैट इज कॉल्ड एज ओजा। Oja, Ayurvedic students again they know about Oja. Oj is the important thing in our body which maintain our body. Oj अगर properly नहीं होगा तो patient cannot survive. It is a survival factor of our body. इन सारी चीजों का maintain रहना बहुत जरूरी है, जिसके कारण से Oj maintain रहता है। Oj अगर हम since birth अगर हम लें, तो as everyone has heard कि 7th month में अगर डिलीवरी हो जाती है, so it can be managed, but 8th month की डिलीवरी it is not very much easy, and 9th month is good for delivery. So 8th month ही क्यों ऐसा बोला गया, जिसमें कि हमें हमेशा खतरा होता है? Anyone want to answer about this? Let me explain. 7th month में it is easy, but 8th month it is not easy, because according to Ayurveda, जो ओज है वो 8th month में कभी माँ के शरीर में होता है और कभी बच्चे के शरीर में होता है थ्रू अम्बिलिकल कॉर्ड। अगर वो ओज बच्चे के शरीर में नहीं होके उस वक्त माँ के शरीर में है और उस टाइम डिलीवरी हो जाए, तो इट इज वे डिफिकल्ट टू मेक प्रॉपर सर्वाइवल ऑफ द किड। इसीलिए ओज इज वेरी मच इम्पॉर्टेंट फॉर द सर्वाइवल ऑफ लाइफ। ये ओज धीरे धीरे कम होना स्टार्ट हो जाता है बिकॉज ऑफ द डिस्टर्बेंस ऑफ ऑल दीज सेल्स। इसीलिए हमें हमारा लाइफस्टाइल और बाकी सारी चीजें मेंटेन रखनी चाहिए, सो दैट वी कैन प्रिवेंट आवर ओज। आयुर्वेदिक पैथोजेनेसिस, एज आई टोल्ड यू अर्लियर, हमारी बॉडी में 3 टाइप के दोष होते हैं, वात, पित्त एंड कफ, एंड 7 टाइप की धातु है हमारी बॉडी में। एज यू कैन सी, रस, रक्त, मांस, मेद, अस्थि, मज्जा एंड शुक्र, दीज आर 7 काइंड ऑफ धातु। अगर इनमें से कुछ भी डीजेनरेट या फिर अपनी सम अवस्था में नहीं रहता है, यानी कि बैलेंस्ड अवस्था में नहीं रहता है, then this accumulation will cause disease in our body. ठीक है? Diagnosis according to modern and Ayurveda अगर हम देखें, तो there are 2 parts, modern and Ayurveda. Some people think about this कि केवल मॉडर्न से ही पेशेंट को ठीक किया जाना चाहिए, या कुछ लोगों को लगता है कि नहीं, केवल आयुर्वेद से ही ठीक करना चाहिए। बट एज अ डॉक्टर आई बिलीव आपको पेशेंट ठीक करना होता है, अभी वो किसी भी पैथी से ठीक हो, चाहे वो मिक्सोपैथी से ठीक हो, पेशेंट ठीक होने से मतलब होना चाहिए। उसमें अगर हमें किसी और पैथी की हेल्प आउट लेनी पड़े तो दैट इज गुड। कभी कभी दूसरी पैथी को गेन करने से हम पेशेंट की कुछ प्रॉब्लम्स को जल्दी डायग्नोसिस कर सकते हैं। एज मॉडर्न साइंस में अगर हम क्लिनिकल एग्जामिनेशन करें, लाइक हिस्ट्री टेकिंग या फिजिकल एग्जामिनेशन, ये हम आयुर्वेदा में भी करते हैं। लेबोरेटरी टेस्ट हम मॉडर्न में ही करते हैं, तो वी कैन टेक हेल्प फ्रॉम मॉडर्न एज इन दिस एस्पेक्ट। नेक्स्ट आता है आपका एडवांस्ड इमेजिंग। एडवांस्ड इमेजिंग अगेन ये आयुर्वेदिक एस्पेक्ट नहीं है, अगेन इट इज अ मॉडर्न एस्पेक्ट, बट एज बिकॉज ये डायग्नोसिस बनाने में बहुत हेल्पफुल है, सो वी कैन गो फॉर दैट ऑल्सो। एंड एविडेंस बेस्ड, एविडेंस बेस्ड का क्या मतलब है कि जो हमारे पुराने डेटा हमने कलेक्ट किए हुए हैं, अकॉर्डिंग टू देम, लाइक एविडेंसेस होते हैं ना कि उस बीमारी में भी ये चीजें थी, हमने डेटा कलेक्ट किया था, उसके अकॉर्डिंगली ऐसे ऐसे पैटर्न्स बने थे, सो वी कैन कोरिलेट एंड वी कैन अगेन मेक अ डायग्नोसिस। ये हो जाएगा हमारा मॉडर्न डायग्नोसिस। अगर हम आयुर्वेद में लें तो देयर इज दशविध परीक्षा। दशविध परीक्षा के कुछ डिफरेंट पॉइंट्स हैं, जैसे कि प्रकृति परीक्षा, इट इज काइंड ऑफ परीक्षण ऑफ द बॉडी कॉन्स्टिट्यूशन। आज कुछ टाइम पहले हमने यहाँ पे IIMT में भी एक सेशन किए थे जिसमें डिफरेंट लोगों के हमने प्रकृति परीक्षण किए थे रिगार्डिंग एवरीथिंग। वी वर डिस्कसिंग कि आप क्या खाना पसंद करते हैं, कैसे आपको नींद आती है, ये सारी चीजें, ऑल दीज थिंग्स कम अंडर द प्रकृति परीक्षण। नेक्स्ट आता है विकृति। विकृति में है करंट इम्बैलेंस। कोई भी हमारी बॉडी, विकृति का मतलब ही है कि किसी भी तरह का दोष अगर बॉडी में प्रेजेंट है या कोई भी डिस्टर्बेंस अगर प्रेजेंट है, तो करंट इम्बैलेंस क्या चल रहा है वो हमें जानना जरूरी होता है। नेक्स्ट आता है सार। सार इज एक्सीलेंस ऑफ टिश्यूज। टिश्यूज का क्या मतलब है, हमारी बॉडी के जितने भी सेल्स हैं या टिश्यू लेवल है उनका प्रॉपर मेंटेन रहना बहुत जरूरी है। नेक्स्ट आता है संहनन। संहनन इज बॉडी बिल्ड। बॉडी बिल्ड एज हम मॉडर्न में देखते हैं कि हमें BMI निकालते हैं, बॉडी मास इंडेक्स होता है, ऐसे ही हम आयुर्वेद में भी संहनन देखते हैं कि बॉडी बिल्ड कैसा है, लीन एंड थिन है या हेवी बिल्ड है। नेक्स्ट आता है प्रमाण। प्रमाण का मतलब है कि प्रॉपरली वेट कितना रहता है। प्रमाण इज इट्स काइंड ऑफ मेजरमेंट। नेक्स्ट आता है साथ में। साथ में अगेन इट इज अ पैटर्न इन आयुर्वेदा थ्रू विच वी कैन चेक आउट कि पेशेंट को क्या चीजें सूट करती हैं इन द डाइट और इन फ्रूट्स। नेक्स्ट आता है आहार शक्ति। आहार शक्ति इज बेसिकली डाइजेस्टिव कैपेसिटी। पेशेंट को भूख कितनी लगती है। जनरली कभी अगर आप किसी आयुर्वेदिक डॉक्टर के पास गए हो तो दे यूज्ड टू आस्क सच क्वेश्चंस कि आपको भूख कितनी लगती है, क्या खाना पसंद है, डाइट कैसी है, मिक्स्ड डाइट है, मिक्स डाइट इन द सेंस वेज, नॉन वेज या प्योरली वेजिटेरियन। तो दीज आर काइंड ऑफ दशविध परीक्षा व्हिच वी यूज्ड टू फॉलो इन आयुर्वेदा। अभी कुछ लिमिटेशंस भी हैं, लाइक इन न्यूरोडिजेनरेटिव डिसऑर्डर्स जो है, बिकॉज एज आई टोल्ड कि ये बढ़े हुए वात के कारण होता है और एक बार का बढ़ा हुआ वात नहीं, ये कॉन्टिन्यूसली थ्रू ईयर्स जब बढ़ा रहता है उसके कारण से होता है। अब इतने लंबे समय से जो पेशेंट बीमार है उनकी ट्रीटमेंट्स हमेशा एक लिमिटेशंस पर आ जाती हैं। एज हमारे आयुर्वेद में जो चरक सुश्रुत इन लोगों ने भी कहा है, हमारे जो आचार्यस हैं इन्होंने भी कहा है कि एक समय के बाद बीमारी जो है वो यापे हो जाती है। यापे इन द सेंस लाइक उन्होंने कैटेगराइज किया है इसको कि साध्य है, साध्य मतलब जल्दी से ठीक हो जाना, असाध्य मतलब जो जल्दी से जो ठीक हो ही नहीं सकता, और यापे का मतलब है आप दवाई खाते रहें पेशेंट ठीक रहेगा, दैट इज यापे। तो ऐसे पेशेंट्स जो बहुत लंबे समय से बीमार हैं, वात रोग उन्हें बहुत लंबे समय से है, उनको हम बेसिकली सिम्प्टोमेटिक ट्रीटमेंट ही दे पाते हैं। ये हमारी लिमिटेशंस हो जाती हैं, उसके आगे आप कुछ कर नहीं सकते। आयुर्वेदिक ट्रीटमेंट की अगर हम बात करें तो वी हैव डिफरेंट पैटर्न्स इन आयुर्वेदा। दो चीजें होती, तीन चीजें हम मान सकते हैं। फर्स्ट निदान परिवर्जन, सेकंड आता है हमारा संशमन एंड थर्ड आता है हमारा संशोधन। निदान परिवर्जन क्या समझेंगे इससे हम? निदान इज बेसिकली कॉज ऑफ डिजीज। अभी परिवर्जन का क्या मतलब है कि उस डिजीज का जो कॉज है उसको हमें अवॉइड करना है। तो प्रिकॉशन इज बेटर देन क्योर, ये आप सभी ने सुना होगा। तो प्रिवेंशन एंड प्रिकॉशन इट इज ऑलवेज गुड। तो निदान का परिवर्जन यानी कि किसी भी बीमारी को कॉज करने वाले जो कॉजिंग फैक्टर्स हैं हमेशा उनसे दूर रहना, दैट इज द वे वन। वे टू इज संशमन। संशमन का क्या मतलब हुआ? मन के अंदर से ठीक करना, यानी कि बेसिकली हम दवाइयां खिला के डिजीज को अंदर से ठीक करते हैं। एंड शोधन का क्या मतलब हुआ? बाहर निकाल के ठीक करना, जिसमें कि हम डिटॉक्सिफिकेशन करते हैं। अगर इसको यहाँ समझें तो इट इज शोधन व्हिच एलिमिनेट्स टॉक्सिन्स, cleanses the body and restore the balance। आपने सबने सुना होगा आजकल डिटॉक्सिफिकेशन काफी कॉमन है। बहुत सारे डॉक्टर्स एंड न्यूट्रिशनिस्ट होते हैं जो कि आपको डिटॉक्सिफिकेशन की किट्स भी प्रोवाइड कराते हैं एंड इट इज ऑल ऑलरेडी रिटन इन आयुर्वेदा। उसी को हम डिटॉक्सिफिकेशन बोलते हैं। सेकेंड आता है इसमें संशमन। संशमन का मतलब यह तो सिर्फ शमन भी बोल सकते हैं। शमन का मतलब है एग्रेवेटेड दोषास को पैसिफाई करना है, मेडिसिन प्रोवाइड करानी है, पेशेंट को इनटेक कराना है मेडिसिन और बीमारियों को ठीक करना है। एंड द लास्ट वन इज रसायन। रसायन का मतलब है टू रीजुविनेट द बॉडी। अभी रसायन में बहुत सारी चीजें आती हैं, आप सबने सुना होगा, च्यवनप्राश सभी ने सुना होगा। च्यवनप्राश इज अ रसायन फॉर द बॉडी जो रेगुलरली खाने से पेशेंट को हमेशा रिजुविनेट रखता है, ठीक है, एंड इट ऑलवेज बूस्ट इम्यूनिटी एंड ऑलवेज प्रमोट्स लॉन्जेविटी. There is one more thing, Panchkarma. We can go for the Panchkarma for such kind of diseases because it actually works. इसमें 3 parts रखेंगे हम, like Basti, and second is Nasya, and one is Shirodhara. What is Basti? Basti is a process जिसमें कि हम colon के through detoxification करते हैं. As मैंने इससे पहले आपको बोला कि detoxification कराते हैं. It is there are 2 kind of detoxification जो हम oral medicines के through and medicines through the rectum और colon. ये हम दोनों तरह से detoxification किया जाता है. So Basti is detoxification through the colon, which actually balances the Vata dosha and provides or promotes overall wellness. Second part आता है इसमें Nasya. Nasya, it is intake of medicine through the nasal passage. ये nasal passage के through दवाई डाल करके हम passages को clean करते हैं और जो हमारे toxins हैं उनको eliminate करने का काम करते हैं. नेक्स्ट आता है शिरोधारा. शिरोधारा आई थिंक ऑलमोस्ट लोगों ने सुना भी होगा, देखा भी होगा, कुछ लोगों ने करवाया भी होगा. शिरोधारा इज अ प्रोसेस व्हिच एक्चुअली calms the mind and reduces the stress and anxiety. और शिरोधारा का सिर्फ एक सिंगल प्रोसेस नहीं है. डिफरेंट टाइप ऑफ मेडिसिन्स, ऑयल, क्वाथ and different varieties of things we can use in Shirodhara. This is a long process to discuss. So basically it nourishes your nervous system and it relaxes your brain so that patient जिनको anxiety है या नींद नहीं आती है, this actually works for them. कुछ हर्ब्स भी हैं, जैसे जो कॉमन हर्ब्स हैं अश्वगंधा और ब्राह्मी. आप सबने सुना ही होगा, ब्राह्मी जो है वो ब्रेन बूस्ट करने का काम करती है. और बचपन में शायद सभी ने सुना भी होगा, पी भी होगी वो दवाई शंख पुष्पी. मोस्टली कुछ स्टूडेंट्स हैं जो एग्जाम से पहले शंख पुष्पी पिया करते हैं जस्ट बिकॉज उनको ऐसा लगता है कि इट एक्चुअली बूस्ट द ब्रेन. बट सिर्फ 2-4 दिन खाने से नहीं होता है. यू हैव टू टेक प्रॉपर स्टेप्स एंड प्रॉपर मेडिकेशन फॉर सच थिंग्स. तो अश्वगंधा का बेसिक काम क्या है? इट रिड्यूसेस स्ट्रेस. आज के डेट में अश्वगंधा वैरायटी ऑफ फॉर्म्स में आपको मिलती है, पाउडर फॉर्म्स में मिलती है, टैबलेट फॉर्म में भी आता है, अभी कुछ कैप्सूल्स भी आते हैं इन विच पर्टिकुलर सम अमाउंट ऑफ अश्वगंधा पाउडर हैज बीन प्रोसेस्ड, जिसके कारण से हमारा बॉडी का कॉर्टिसोल लेवल बैलेंस होता है. अश्वगंधा बेसिकली किसी पर्टिकुलर एक चीज पे काम ना करके ओवरऑल हमारे सेल बेस्ड प्रोसेस पर काम करता है. And it supports the brain function also. Concentration बढ़ाता है, memory boost up करता है, energy enhance करता है, stamina regain करने का काम करता है. All those patients who are suffering from Vata, they eventually lose up their energy. तो उसको वापस से reboost करने के लिए अश्वगंधा is very much important. Second thing आती है ब्राह्मी. ब्राह्मी is the thing which improve your memory, improve your thinking and also your cognitive functions. It calms the mind and keep the body restored. ब्राह्मी भी आप एक जूस के फॉर्म में भी आजकल मिलता है, शरबत के फॉर्म में मिलता है, इवन पाउडर, टैबलेट, वैरायटी ऑफ फॉर्म्स में आपको ब्राह्मी अवेलेबल है सब. और ये आपकी बॉडी की जो नर्व हेल्थ है उसको भी सपोर्ट करता है. नेक्स्ट आता है रसायन. रसायन में अगेन दैट रिजुविनेशन थेरेपीज रहती है इसमें. इट बूस्ट योर इम्यूनिटी, स्ट्रेंथन द बॉडी, नेचुरल डिफेंस. नेचुरल डिफेंस आपने एड्स देखे होंगे, च्यवनप्राश के एड जनरली सर्दियों में ही आते हैं, बट इट इज नॉट द थिंग विच कैन बी एडमिनिस्टर्ड ओनली इन विंटर्स ओनली. ठीक है, च्यवनप्राश या किसी भी टाइप का रसायन मौसम के हिसाब से नहीं, वो प्रकृति और शरीर के हिसाब से एडमिनिस्ट्रेशन कराना चाहिए. इट बूस्ट योर इम्यूनिटी, एनहांसेस योर मेंटल फंक्शन, reduces stress and anxiety, promotes longevity, improves vitality and stamina, and also nourishes tissues. अभी टिश्यूज को नरिश करने का मतलब क्या है? रिपेयरिंग ईच एंड एवरी पर्टिकुलर सेल. जितना ज्यादा हमारे बॉडी सेलुलर लेवल पर इम्प्रोवाइज करेगी, जितना ज्यादा हमारे सेलुलर लेवल पर हमारी बॉडी स्ट्रेंथन रहेगी, हेल्दी रहेगी, उतना ही ज्यादा हमारी बॉडी फिट रहेगी. डाइट, हमने हमेशा सुना है कि सात्विक डाइट इज ऑलवेज गुड। अभी वो सात्विक डाइट होती क्या है? जो कुछ हम खाते हैं आजकल, मंचिंग कर रहे होते हैं, रोड साइड फूड खा रहे होते हैं, दैट डजंट कम्स अंडर सात्विक। और जिन लोगों को लगता है कि हम घर पे तो सात्विक खाना खा ही लेते हैं, पर ठीक है बाहर थोड़ा मोड़ा चटर पटर हर रोज चलता है, दैट इज ऑल्सो नॉट गुड। आप एक तरफ अच्छी चीज खा रहे हैं, बट ऑन द अदर हैंड आप बेकार चीजें खा के जो आपने बैलेंस किया था उसको खराब कर देते हैं। तो इट इज ऑलवेज सेफ कि आप हमेशा एक सात्विक डाइट खाएं। बट आई कैन अंडरस्टैंड अकॉर्डिंग टू दिस पर्टिकुलर प्रेजेंट सिनेरियो, कभी कभी वाला सीन ठीक है, बट रेगुलर बेसिस पे इफ यू आर गोइंग फॉर अ अनहेल्दी डाइट देन इट इज नॉट गुड फॉर योर लॉन्जिविटी। इसमें सात्विक डाइट का बेसिक रोल क्या है? इट इज प्योर एंड नेचुरल, इट शुड बी प्योर एंड नेचुरल, which particularly comes from fresh fruits, fresh vegetables only. बहुत सारे लोग पुराना, आयुर्वेद तो हमेशा कहता है कि पुराना बासी खाना नहीं खाना चाहिए, बट यूजुअली हम लोग क्या कर लेते हैं कि खाना एक बार बनाया और अगले दिन उसको गर्म करके भी खा लेते हैं। दैट इज नॉट अ हेल्दी फूड। आपका हेल्दी फूड सिर्फ एक पर्टिकुलर टाइम के लिए ही था, जिस टाइम आपने बनाया है उसको एक पर्टिकुलर टाइम ड्यूरेशन में ही खाना है। नेक्स्ट इसका काम क्या है? टू प्रमोट मेंटल क्लैरिटी। जितना फ्रेश फूड, जितना फ्रेश डाइट आप लेंगे, उतना ज्यादा आपका ब्रेन क्लैरिटी पे रहता है। इजी टू डाइजेस्ट, जितना फ्रेश फूड होगा उतना जल्दी डाइजेस्ट होगा, और डाइजेशन जितना अच्छे से होता है उतना ज्यादा हमारी बॉडी उस चीज को, उस डाइट को प्रॉपर्ली एक्यूमुलेट करती है। और ये क्या करेगा? बूस्ट एनर्जी करेगा, इम्यूनिटी बढ़ाने का काम करता है, सपोर्ट स्पिरिचुअल ग्रोथ। जितना ज्यादा आप हेल्दी डाइट खाते हैं उतना आपकी स्पिरिचुअल ग्रोथ भी बढ़ती है। आप ट्राई करके देख सकते हैं, रेगुलर 1 मंथ आप सिर्फ और सिर्फ स्ट्रीट फूड खाइए, देन अगेन नेक्स्ट मंथ आप स्ट्रीट फूड प्लस घर का फ्रेश फूड खाइए, देन थर्ड मंथ आप केवल घर का ही फ्रेश डाइट खाइए। तीनों मंथ में आपको अपने अंदर बहुत सारे चेंजेस खुद ही नजर आ जाएंगे। एंड इट इज एक्चुअली प्रोसेस्ड फूड जितने आप लेते हैं, ये सारे के सारे आपको लगता है कि ये तो आज ही पैक होकर के आया है, विद इन अ मंथ आपको खाना है, बट दे आर नॉट हेल्दी। फॉर एग्जाम्पल, अगर आप छोटे बच्चों के लिए ले लें, हम लोग जो मदर्स हैं, बिकॉज उनको टाइम नहीं है या वो करना नहीं चाह रहे हैं, जनरली करना तो सभी चाहते हैं, बट टाइम की कमी की वजह से हम लोग बच्चों को सेरेलेक खिला देते हैं। फॉर एग्जाम्पल मैं सेरेलेक ही बता रही हूँ। सेरेलेक एक्चुअली में क्या है? उसमें 1 मंथ की एक एक्सपायरी डेट होती है, 1 और 2 मंथ की, कि 1-2 महीने में ये एक्सपायर हो जाएगा। बट क्या आपने कभी उसका प्रोसेस जाना है? सेरेलेक इज अ प्रोसेस्ड फूड जिसमें कि हम कुछ सीरियल्स ले लेते हैं, चाहे वो गेहूं है या चावल है या रागी है या व्हाटएवर, या उस पे एप्पल की भी एक फोटो बनी रहती है आजकल की, इसमें एप्पल भी है, स्ट्रॉबेरीज भी हैं। उसको लिया जाता है, बॉईल किया जाता है, अगेन उसको ड्राई किया जाता है, पाउडर किया जाता है, और फिर पैक करके आपको भेज दिया जाता है। तो जो आपने पका हुआ खाना वापस से ड्राई करके पाउडर किया, उसमें सिर्फ अब आपको गर्म पानी मिलाना है और तब आप बच्चे को देंगे। लेकिन वो कब उबाला गया था, कब उसको ड्राई किया गया था, कहाँ ड्राई किया गया था, यू नेवर नो। अभी इतना पुराना खाना आप अपने बच्चे को डे 1 से खिला रहे हैं, सो इट्स बेटर कि आप अपने बच्चों के लिए इतनी सी मेहनत नहीं कर सकते हैं कि आप खुद एक फ्रेश फ्रूट काट के उसको बॉईल करके अपने बच्चे को खिला सके, या फिर फ्रेश आप चावल बॉईल करके उसको मैश करके बच्चे को खिला सकते हैं। सो इट इज गुड ऑलवेज टू प्रोवाइड द फ्रेश फूड, नॉट द पैक्ड एंड प्रोसेस्ड फूड। फॉर एग्जाम्पल एक और है लैक्टोजन और जो ये पाउडर्ड मिल्क आते हैं, somehow आज की डेट में काफी फैशन में है कि पाउडर्ड मिल्क आर ऑलवेज गुड। मे बी हो सकता है बिकॉज ऑफ फ्यू रीजंस लाइक बैक्टीरियल इन्फेक्शंस, आजकल बहुत सारे वी हैव डेटाज आल्सो, बट स्टिल डू यू बिलीव कि पाउडर्ड मिल्क आपके बच्चों के लिए हेल्दी है या पाउडर्ड पैक्ड प्रोसेस्ड फूड हेल्दी है? ऐसे ही जो हमारे बर्गर, पिज्जाज, व्हाटएवर वी आर ईटिंग, दीज आर आल्सो नॉट हेल्दी। फॉर एग्जाम्पल जो चिप्स होते हैं, आप कभी अपने चिप्स के पैकेट्स को पलट करके उनको पढ़ के देखिए, उसके अंदर क्या डला है। मैक्सिमम पैकेट्स के पीछे लिखा होगा पाम ऑयल। पाम ऑयल इज नॉट फॉर इंडियन ह्यूमन बीइंग्स, इट इज नॉट ईटेबल दैट मच, बट स्टिल इंडिया में सबसे ज्यादा ये पाम ऑयल आता है क्योंकि पाम ऑयल काफी सस्ता होता है और बाकी सारे ऑयल से उसको मिला करके दे दिया जाता है, सिर्फ इसलिए क्योंकि वो सस्ता था और आपको खाने के लिए मिल गया। तो आप अपने पैसे बचाने के लिए अपनी हेल्थ के साथ कॉम्प्रोमाइज कर लेते हैं, बट क्या आप बाकी में चाहते हो कि आपकी हेल्थ कॉम्प्रोमाइज की जाए? आप अपनी छोड़िए, आप अपने बच्चों की हेल्थ कॉम्प्रोमाइज कर देते हैं जस्ट बिकॉज सिर्फ वो 10 रुपए का एक पैकेट आ जाता है, उसके अंदर चिप्स है। बहुत सारे चिप्स के पैकेट्स के आप पीछे पढ़कर देखेंगे, उसमें कॉटन सीड भी लिखा है। कॉटन सीड ऑयल जो है दैट इज नॉट गुड फॉर ईटिंग। उसके बावजूद बहुत सारी ब्रांड्स हैं जो कॉटन सीड ऑयल्स में चिप्स को फ्राई करके और पैक करके भेज दे रहे हैं। These all are reducing your life. तो ये जितने भी पैक्ड फूड्स हैं, इंक्लूडिंग द क्रीम बिस्किट्स, आपको लगता है कि these are cream, बट अगर आप उनकी स्पेलिंग देखें दैट इज क्रेम, CREME, दैट इज नॉट क्रीम। क्रीम होती है जो दूध से बनती है, बट क्रेम इज ऑलवेज मेड विद पाम ऑयल। You are not eating the cream, you are eating the palm oil. Even the butter you are using, that is not actually butter. That is also palm oil. That is processed. Different varieties are giving you kind of dangerous diseases as a gift. So always you should be aware what you are eating, what you are giving to your children, what you are giving to your family. ऐसे ही आज की डेट में आप अगर पैक दूध भी लेते हैं मार्केट से, आपको लगता है कि फ्रेश मिल्क आया है, बट डू यू एक्चुअली नो कि वो कितने ज्यादा प्रोसेसिंग होकर के आया है? हाउ मेनी काइंड ऑफ इंजेक्शंस द काउ और buffalo were taking during the process? So all these things are not healthy. Whatever you are eating, it is always giving you diseases as a gift and reducing your life. एक इम्पॉर्टेंट चीज है इसमें लाइफस्टाइल, जो मैंने बहुत देर पहले डिस्कस किया था। लाइफस्टाइल हमेशा आचार्यों ने मेंशन किया है कि इट शुड बी मेंटेन, एंड हाउ इट शुड बी मेंटेन। लाइक फर्स्ट एग्जांपल है इसमें दिनचर्या। दिनचर्या का क्या मतलब है कि किस टाइम आपको सुबह उठना है, उठने के बाद क्या करना है। अभी आज की डेट में किसी की कोई दिनचर्या नहीं है। एवरी पर्सन इज वेकिंग अप एट 11 o'clock, स्लीपिंग एट 1 AM, नॉट 1 PM, इट इज 1 AM। तो रात के 1 बजे सोना, इट इज नॉट योर लाइफस्टाइल। और लाइफस्टाइल डिसऑर्डर्स बहुत डेंजरस होते हैं। दे कैन इवेंचुअली गिव यू डायबिटीज, दे कैन गिव यू न्यूरोडीजेनरेटिव डिसऑर्डर्स, ऑटो इम्यून डिसऑर्डर्स। ये सारी बीमारियां आपकी लाइफस्टाइल खराब होने की वजह से ही होती है। कॉमन डिजीज है जो आप सबने सुनी होगी, PCOD। वो PCOD भी लाइफस्टाइल डिसऑर्डर है। आज की डेट में बहुत कॉमन है इनफर्टिलिटी। ये सारे हमारे लाइफस्टाइल डिसऑर्डर की वजह से ही क्रिएट हो रहे हैं। दिनचर्या में सबसे पहले आता है वेकअप अर्ली। अर्ली मॉर्निंग का क्या मतलब है? जिस टाइम सनराइज हुआ है तब आपको उठना है, जो कि शायद हम में से कोई भी नहीं उठता है। नेक्स्ट आता है ओरल हाइजीन। ओरल हाइजीन का मतलब है जब आप सुबह उठे हैं, उठने के बाद सबसे पहले आपने ब्रश करना है, क्लीनिंग योर टीथ, क्लीनिंग योर टंग ऑल्सो, कंप्लीट ओरल हाइजीन। देन गो फॉर द एक्सरसाइज एंड योगा जस्ट टू कीप योर बॉडी एंड माइंड एक्टिव। Then eat mindfully. Eat mindfully का क्या मतलब है? हम लोग आजकल खाना कैसे खाते हैं? या तो टीवी के सामने बैठ के या मोबाइल हाथ में लेके। अभी जो आप खाना खा रहे हैं वो खाना आपके पेट में जाके प्रोसेस होना चाहिए था एंड डाइजेशन स्टार्ट होना चाहिए था फ्रॉम योर माउथ ओनली। हमारे मुंह के अंदर भी सलाइवा के साथ कुछ डाइजेस्टिव एंजाइम्स हैं जो प्रोड्यूस होते हैं, बट वो सारी प्रोसेस तभी होती है जब हम प्रॉपरली फोकस करके खाना खाते हैं। बट हम लोग प्रॉपरली फोकस करते ही नहीं है। हमारा पूरा फोकस या तो मोबाइल में रील्स देखने में होता है या टीवी पे न्यूज सुनने में होता है। आपने क्या खाया आपको याद भी नहीं रहता है, आपको टेस्ट भी नहीं याद रहता है। तो इसीलिए आयुर्वेद में लिखा है ईट माइंडफुली। नेक्स्ट आता है स्लीप अर्ली। स्लीप अर्ली का मतलब है आप जल्दी खाना खाएं। पहले आपने पुराने जमाने में देखा होगा या कभी सुना भी होगा कि गांव में लोग जो है वो सूरज ढलने से पहले खाना खा लेते थे। इट इज हो सकता है माइट भी कि अंधेरा होने से पहले खाना खा लेते थे, बिकॉज लाइट नहीं होती थी इतनी, तो अंधेरे में तो खाना कोई नहीं बनाएगा। बट एक फैक्ट है जो आयुर्वेद मेंशन करता है कि सूरज ढलने से पहले आप खाना खा लें। उसके बाद यू शुड टेक टाइम, यू शुड गिव टाइम टू योर बॉडी फॉर द डाइजेशन। उसके बाद आप सोएं। बट आप खाना खाते ही लेट जाएंगे तो आपकी बॉडी को प्रोसेस करने का टाइम नहीं मिलेगा, आपका डाइजेशन प्रॉपर्ली नहीं होता है। तो खाना जल्दी खा के टाइम दे करके आपका डाइजेशन कंप्लीट करके उसके बाद आपको जल्दी सोना है। नेक्स्ट आता है इवनिंग रूटीन। व्हाट इज काइंड ऑफ इवनिंग रूटीन? इट इज अनवाइंड। अनवाइंड का मतलब क्या होता है? जो भी कुछ आपने मॉर्निंग से इवनिंग तक किया, आपका ऑफिस या आपका वर्क, वॉट एवर यू आर डूइंग, आपको उसे अनवाइंड करना है। सिर्फ अपने ब्रेन से बाहर रखना है सो दैट आपके ब्रेन रिलैक्स कर सके। आपके ब्रेन को भी टाइम चाहिए होता है। जैसे आप थक जाते हैं, फिजिकली थक जाते हैं, आपको रेस्ट चाहिए, ऐसे ही आपके ब्रेन को भी रेस्ट चाहिए होता है। नेक्स्ट आता है इसमें वर्क माइंडफुली। अगर आप ऑफिस जा रहे हैं तो आप माइंडफुली वर्क तभी कर पाएंगे जब आप प्रॉपरली सुबह से अपनी जो लाइफस्टाइल है उसको मेंटेन कर रहे होंगे। एंड सेल्फ केयर। सेल्फ केयर इज जब आप सुबह उठते हैं तब आपका एक रूटीन जो है कि आपने ब्रश किया एंड ऑल, उसके बाद आपने प्रॉपरली नहा धो के प्रॉपर रेडी होना है। एक कहावत भी है कि अच्छी जगह पे ही लक्ष्मी आती है। वो इसीलिए क्योंकि साफ सुथरी चीजों को ही साफ सुथरी चीजें अट्रैक्ट करती हैं। Yoga is very much important for maintaining the Vata dosh and maintaining the neurodegenerative disorders or depression or anxiety. ये हमारे बॉडी को स्ट्रेस फ्री कराता है, हमारा फोकस इम्प्रूव करता है और कंसंट्रेशन बढ़ाता है, इमोशनल बैलेंस कराता है। योगा सुनने में थोड़ा बोरिंग लगता है बट योगा एक्चुअली वर्क्स। हमारी एंजाइटी को लोअर डाउन करता है एंड हमारा नींद भी अच्छा करता है। अब एक इंटीग्रेटिव मॉडल है, वो इंटीग्रेटिव मॉडल में क्या है, मॉडर्न मेडिसिन और आयुर्वेदा इन दोनों के साथ हम पेशेंट को ट्रीट कर सकते हैं। कैसे कर पाएंगे? अगर मॉडर्न मेडिसिन में हम देखें तो एक्यूरेट डायग्नोसिस हमें बनाना है, वो चाहे हमें किसी एडवांस्ड टूल से करना हो हम उससे भी कर सकते हैं। प्लस एविडेंस बेस्ड ट्रीटमेंट होते हैं। नेक्स्ट आता है इसमें मैनेजमेंट ऑफ एक्यूट कंडीशंस, मॉनिटरिंग एंड सेफ्टी। जितना भी हमारे न्यू डिजाइन्स या न्यू हमारे इंस्ट्रूमेंट्स हैं उनसे हेल्प लेकर के हम पेशेंट को डायग्नोसिस करके और उसका मैनेजमेंट कर सकते हैं। आयुर्वेद के अकॉर्डिंग अगर देखें तो रूट कॉज की अप्रोच हमें बहुत जरूरी है। देन डिटॉक्सिफिकेशन जो हमने शोधन चिकित्सा बोली थी, हर्ब्स एंड नेचुरल थेरेपीज एंड रिजुविनेशन या रसायन चिकित्सा जो हमें करनी है वो हम ये दोनों चीजों को मिला करके पेशेंट को ठीक कर सकते हैं। अगेन दिस इज इनोवेशन, जस्ट कि हम स्टेम सेल्स और न्यूरोप्लास्टी कर सकते हैं। और केसेस में अगर हमने तो दोनों ही डिजीजेस में, चाहे वो पार्किंसंस हो या डिप्रेशन हो, आप बिफोर एंड आफ्टर के रिजल्ट्स इजीली देख सकते हैं कि जब हम लाइफस्टाइल एंड डाइट मेंटेन करते हैं या इन हर्ब्स का यूज करते हैं तो पहले और बाद के रिजल्ट्स बहुत डिफरेंट होते हैं। और रिसर्चेस एंड क्लिनिकल एविडेंसेस आपको ऑनलाइन भी बहुत सारे मिल जाएंगे एंड यू कैन गो थ्रू दैट, जिसकी वजह से हमारा जो आउटकम है वो बहुत इम्प्रूव होता है। फ्यूचर इज दिस कि हम अगर आजकल AI भी काफी कॉमन है, AI की हेल्प से भी हम बहुत सारे डायग्नोसिस मेंटेन कर पाते हैं। एंड आयुर्वेदा के अकॉर्डिंगली तो मैंने आपको बहुत सारी चीजें डिस्कस कर ही दी है। दीज आर ऑल दोज थिंग्स ओनली कि बैलेंस करना है दोष को, नेचुरल हमें चीजें यूज करनी है, दैट्स इट। कंक्लूजन इज जस्ट कि रूट कॉज ट्रीट हो जाएगा, देन पेशेंट ऑब्वियसली ठीक हो जाएगा एंड इट इज ऑलवेज गुड टू ट्रीट योर पेशेंट्स। Thank you. Any questions? Okay, thank you.
Thank you, ma'am, for your insightful and engaging presentation. Now I request Dr. Garima ma'am and Dr. Miran sir to kindly present a memento to our esteemed speaker, Dr. Pragya, as a token of appreciation.
डायरेक्टली बंद होगा।